Welcome to INOvators, a series where we sit down with thought leaders in the healthcare technology space to talk about news and trends impacting the industry today. My name is Justine Gincola. I'm on the corporate communications team at Inovalon, and joining me today is Terance Fowler, the Executive Director of Quality at Aetna. Thanks for being here today, Terance.
Thank you so much, Justine.
Before we get started, just tell me a little bit about yourself and your role at Aetna.
So I got into the quality space several decades ago. I was one of the original certified HEDIS compliance auditors starting back in 1998. And I did audit and consulting in the healthcare space. I've followed very similarly the Inovalon timeline and growth over the past 25 years. And then I came in-house with Aetna a little over 2 years ago. And I primarily focus on running all of our quality programs for our duals business, but I also work heavily with the Medicare Advantage STARS program and also, by definition, the Medicaid programs.
Well, then you are clearly the person for this conversation today. We are at the very start of HEDIS season. What are some of the biggest challenges that payers might have with their quality reporting this year? And is there any advice you have as far as helping them prepare?
Some of the biggest challenges that we have that we're facing are the conversion of measures that are moving away from hybrid. So that's obviously a very big concern for us, and how to make sure that we capture the data through claims and other administrative sources. Also, gathering more information on the social risk factors that our members have, and being able to better mine that data to create initiatives that deliver programs that meet our members' needs when and where they are, so that we can help them improve their health.
And that, of course, is the point of everything that we do here, is that outcome at the end of it. But tell me a little bit more about the value of accurate, complete reporting beyond just STARS. What does complete member data mean for health equity and really driving impactful change for members?
So certainly the new Healthy Equity Index reward factor is something that we and all plans are interested in. But the reality is that, especially for my members in our duals plans, those members live and act differently than a typical member in a Medicare program, and differently than in a commercial program or a marketplace program or a Medicaid program. And those social risk factors help us and our care managers figure out the best way to deliver the services that that member needs, because when they're concerned about some of those issues relating to possibly living in a food desert or a pharmacy desert or a PCP desert, each of those presents a different challenge, and what services we have to provide them are different depending on each of those circumstances. And the better we build our database of information about these members in a way that we can mine it and use it effectively, because the reality is often our care managers know, and in the past it's been in comment fields and things like that, but now we need to get it codified for all of our members so that we can really act upon it in a meaningful way.
And this is kind of where, technology, AI, and all the advancements we're seeing there come into play. So tell me a little bit about how you think AI is coming into the mix and how advanced models can, learn from and analyze that SDOH data.
So I believe that AI can help us with a tremendous number of challenges that we have, but specifically related to what you're talking about there, like one area that I would really like to expand our use of it is relating to our readmissions for members, and having AI be able to look across our members and pull in the social risk factor information, because that often is a major factor that contributes to why that member is readmitting more frequently. Sometimes it does have to do with the diagnosis, but very often it's actually the diagnosis plus a combination of the factor that maybe they don't live close to a pharmacy, or they aren't even as able to, they have literacy issues often, et cetera, that can be a factor, or food can be a factor, et cetera. So if we can build that model, and AI, I believe, can really help us get to the next level of being able to act upon that information at a member level rather than just kind of creating programs at a high level.
Absolutely. So I guess kind of next question, and maybe how we want to wrap up here today, is how do you think that we get there? What is the first step that a health plan needs to take to get to that point of AI-driven analytics that are informing some of these programs?
So first thing, I think we have to get over the fear of using AI and the fear of what is AI going to learn about our members, the privacy issues relating to all of this wealth of information that we do have, but we've got to deal with that fear and start utilizing it so that we can get to the next level of analysis that helps us drive better results and outcomes for our members ultimately.
Absolutely. And, again, you said it throughout this conversation, but really love the emphasis on those clinical outcomes. So, Terance, thank you so much for sitting down with us today. It was great talking to you. And, of course, good luck with HEDIS season. And to our audience, thank you for tuning in today. And be sure to check out our next episode of INOvators.